Hey, are you studying for your CPT and you're struggling with your heart anatomy? Then watch this. Your heart is one of the 3 muscle types that are incorporated within your body. You got smooth muscles, you got skeletal muscles, and you got your cardiac muscle, which is your heart. The heart is responsible to pump blood towards your tissue within your body and deliver nutrients, remove waste, and other things from your body. Your heart can be divided into 2 sides. One side is the pulmonary side, which receives the oxygenated blood from your body and pumps it towards the lungs, and the systemic side, which receives oxygenated blood from your lungs and pumps it into your system. It consists of 4 chambers: the atrium on the top, the ventricle on the bottom. The way you can remember where those chambers are located, if you look at the bottom of the heart muscle, you can kind of see this V shape. Versus with a lot of imagination, you can even see an A on top where the atrium is. The pacemaker of your heart is located in your right atrium. It is called the synovial node or SA node. The atrioventricular node delays the signal in order to allow your atrium to completely fill up before the blood passes into your ventricle. There are 2 main blood vessels within your body. We have arteries and we have veins. Arteries always go away from your heart and veins always come towards your heart. So, that being said, what does that mean? If you look at your systemic side, you have oxygenated blood. From here, you pump the blood through your artery all the way around to your tissue. In your tissue, the artery is going to subdivide into smaller blood vessels like capillaries. And from there, you're going to have eventually a chemical exchange where your blood turns into the oxygenated blood and the capillary flows towards veins, and those are transporting the blood back to your pulmonary side. In your pulmonary side, your blood comes first into atrium, then into your ventricle. And then there's one thing that is a little bit different. You still have an artery going back from your pulmonary side into your lungs. But this artery is not carrying oxygenated blood, it's deoxygenated blood. Within your lungs, in those capillaries, your blood gets oxygenated again. It flows back to your heart in the pulmonary vein. Again, oxygenated blood in your pulmonary vein. There it goes into the atrium, back into your systemic side, okay, back into the ventricle on your left side, and from there back into your bloodstream. So remember, the pulmonary artery is carrying deoxygenated blood, goes towards the lung, because every artery goes away from your heart. Your pulmonary vein carries deoxygenated blood, comes back to your heart, because every vein comes back to your heart. On your systemic side, your artery is carrying oxygenated blood into your system, where it turns into deoxygenated blood, coming back to your heart in veins. If you have any more questions, shoot me a DM on Instagram or leave me a comment here. We are offering one-on-one tutoring. If you're still struggling with other topics, we are happy to help. So make sure to reach out. We want you to get past as quick as possible to get you out there to seek mentorship and to get out training and follow your dream. All right, see you soon. Bye.